Hi. Hello, welcome to Knock Knock Hi with the Glaucomfleckens. I'm Will Flannery, also known as Dr. Glaucomflecken.
I am Kristen Flannery, also known as Lady Glaucomflecken, and I apologize on Will's behalf for anyone's eardrums that have been bursted in this introduction.
I'm fired up,
Whew. Yeah,
ramped up.
because we have a topic today that if this doesn't get you fired up, nothing will. You know, you might want to check your pulse.
Well, that, but also my afternoon got canceled because of weather.
Oh, yeah. So that's good.
I get to watch a football game this afternoon.
Oh, so you're excited. Good. I'm glad to know you'll be home. I've got some things that need done.
But we do have a topic that'll get your juices flowing
Sure
here.
do.
We're talking about healthcare.
The healthcare system.
The healthcare system with U.S. Senate candidate and U.S. Congresswoman Katie Porter.
Mm-hmm.
Yeah, it's very exciting. The whiteboard extraordinaire.
That's right.
That's
That
what she
is-
kind of has
she-
gone
her
viral on
visual
social media
aids
for.
as
Visual
well.
aids,
Mhm.
just a natural educator.
Yes, spells complicated things out very simply and clearly and makes it easy
Really
to
impressive.
understand.
But we've been on the healthcare reform. What do you call it? The healthcare reform
Bandwagon.
Is it a bandwagon? I think it's a bandwagon for quite some time. You guys, if you've
Yes.
seen my video, I love talking about the healthcare system. Does this topic interest you though? I'm just like, because you come to it from a different lens, from a different viewpoint. I guess because you've been through all the medical stuff that I've gone through. Have you picked up on a lot of this stuff along the way?
Well, yes, I have, just sort of from being around it, but I've also been a patient, right? Like and not I don't just mean like wellness visits and stuff. I mean like I have this weird chronic thing that nobody understands. I have had a neck surgery in my early 30s. Like that's weird.
Yeah, you got to
right?
interact with a neurosurgeon,
I did, yes. I really did, a real one in real life.
an actual one, an attending no less.
And then yeah, I've seen everything that you've gone through. I've seen everything our children have gone through, right? And I've been the healthcare decision maker for them. I think this is just something that affects everybody, and I think it's made overly complicated. And it's there's all these big words and things. To your point of have I picked things up? I think there are more of those than there need to be, but I think that's why it's so good to have people like Katie Porter, like yourself, who are kind of breaking it down and, trying to make it easier for everyone to understand. And recently, this is going to sound like a plug. I guess it's maybe a shameless plug, but, we have a blog and a newsletter now where we're trying to take the progress that you've made and expand on that and the ideas that you share in 30 Days of Healthcare and expand on that.
Yeah.
So yeah, I think this is really something that's important for everyone, whether they are in healthcare, not in healthcare, because we all have to interact with the healthcare system. And it's a big mess.
It's a mess. And that's it. So that's why we have Katie Porter here to try to sort through this mess. And one reason, which we get into in the episode, that we were so excited to talk with her, is because she is not beholden to any corporation.
Yes.
Right? She doesn't take lobbying money, and which allows her really just to speak freely, speak her mind, really try to fight for positive change in the healthcare system. So
Yeah.
we
And
get
to
into all that.
actually represent her constituents. Can you imagine?
Imagine that.
What
That's
a novel
amazing.
idea.
So it was a great conversation. I hope you enjoy it. Should we get to it?
Let's go.
All right, here we go. Here is Senate candidate Katie Porter. Today's episode is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This AI-powered ambient technology helps physicians be more efficient and reduce clinical documentation burden. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discoverdax. That's nuance.com/discoverdax. All right, we are here with Congresswoman Katie Porter. Thank you so much for joining us, Katie. It's really an honor to talk with you today. Talk with us.
No.
Talk to you. It's an honor to talk to you today.
It's a delight to talk with you too.
So we appreciate you taking the time. And you may not know this, but we have an Iowa connection here.
I
Yes,
do.
it's a
Kristen, you used to
very
work at the University of Iowa. Is that right?
yes, I was gonna say it's a very obscure one. Usually, they would know that he did residency at Iowa,
Uh-huh.
but yes, I worked at the Bell and Blank Center for Gifted Education at the University of Iowa, and
Wait, you know my history with the Bell and Blank Center.
I sure do. I was
Yeah.
about to say you were a participant in one of our programs before I got there, but when you were growing up in Iowa. So,
Yeah, I think I was in the
yeah,
first year
I
that
think
the Bell
so.
and Blank Center. For those of you who are listening and don't know what that is. It is a basically like nerd camp.
Yep.
Yeah.
And so for super smart kids, and I grew up in a very rural part of Iowa where there was not a lot of a lot, like none, no enrichment education for gifted kids. And so I came and spent my summer of following eighth grade at the University of Iowa campus back in the day. And then my sister and brother-in-law also they went to medical school at the University of Iowa.
It's a good
Okay.
And then
medical school.
they did their fellowships elsewhere, but they did their and their residencies, but they did their medical education there. So
They're big
Yeah.
on nerd camps at the University of Iowa.
Yeah, they
Yeah,
really
it's
are.
good.
I mean, I am also very big on nerd camp and anything sort of like that. So that was a fun connection to find. And it's no surprise I think it was a leadership class or a program, the Iowa Governors Institute.
yep.
So
So all your success you attribute to
that's
the
right.
Bell and Blank Center.
That's right. That's right.
Right.
But then I actually taught at the University of Iowa as well.
Oh wow.
So I can't. What year were you there doing your residency? Well,
2014 to 2017. So I think
yeah.
we
So
missed each other
I
because
would
I
have
think
missed you because you're so much
yeah.
younger. Thank you for pointing
Yeah.
that out.
I didn't say it. All right. We just
Yeah,
missed
you
each other.
asked.
Missed connection. That's all it is.
Uh,
So Katie, I'd love to start here with just a really easy question. Uh, how do we fix healthcare? Is that
Yeah,
easy enough?
yeah,
That's simple, straightforward kind of question, right?
yeah.
Can we do that? Can we get that accomplished in the next half hour, do you think?
Well,
What
so
do you
we can,
think?
the answer to how to fix it, I think I can get accomplished in about 30 seconds. Getting it done, I sometimes despair we ever will in this country. So, I mean, I think there are two healthcare issues. I'm just going to frame up how to fix it. One is we think about healthcare wrong in this country. We think primarily about sickness and how to fix people who are already sick instead of focusing on health and wellness. So instead of talking about healthcare, what Congress really does is make policy about sick care, not about healthcare. And I think
mm,
that affects all different kinds of ways that we invest and don't invest in healthcare. And then I think the other thing is, look, you are not going to have the kind of healthcare system that delivers healthy people and focuses on that when you have a profit driven system. It's just
Right.
inconsistent. I have a background in consumer protection. And it turns out, for instance, that cheating people is really, really profitable. That's why companies do it, right?
Yeah.
Customers who don't pay their bills are more profitable for banks and run up interest rates and pay their credit card minimums rather than pay it off are more profitable for banks. It's the same thing for healthcare. Sick
Mhm.
people up to a certain point and certain kinds of sick people are actually incredibly profitable for many parts of the healthcare system.
Mhm. And on the medical delivery side, as a physician, we are very much focused on preventive care, where a lot of what we try to do is to try to keep people healthy, and so we're just from a fundamental standpoint, we're at odds, right, with the some of these big corporations that for basically are running healthcare. It feels like, at least,
No,
and I
and
know,
I think one of the
yeah,
things that's really changed in the last, and I don't know if you have thoughts on this from your experience, but I think there's been a break. There's really starting to be a fissure between doctors who originally, really were kind of the entities, doctors that kind of formed health insurance companies back in the
yeah,
day, and where we are today, which is, I think, increasingly providers, doctors, nurses, and others are some of the most powerful critics of health insurance and of big pharma. And so I really think it's an important voice that you have, that this podcast has, that Kristen has as a patient advocate. Like, this is a really important perspective. So increasingly, I have doctors who are side by side with me pushing for things like Medicare for all, pushing for things like rethinking treatment and reimbursement in ways that do give time for doctors, for instance, to focus on preventative care. But as you know, we have a
Yeah.
very kind of procedure-driven reimbursement system that does not really reward doctors who went into this to help people be healthy for their time spent doing exactly that.
Yeah, no, I totally agree. We devalue primary care in particular, and that's just one of the many problems that we're dealing with now. And I do think I don't know what the change was. Maybe it's just gradual over time. I don't think we can put one thing on it that caused, because you're right. The physicians are like, we did help build this system. Like there's absolutely, but I totally agree with you. It does seem like there's been a change, and I guess I'm not sure like what caused that change, but it is. I do feel it happening. Uh,
Citizens United.
y-
I'm sorry.
I think one of the things is, you know, I think when doctors went to insurance companies and kind of formed things like the early Blue Cross Blue Shield, these cooperative ideas. They were really well intentioned, but I think what doctors are now living with, and when I say doctors, I really mean healthcare providers
right,
broadly, because I
right,
think, you know, nurse practitioners and nurses and phlebotomists, I think there's a whole ecosystem of people who make us, who deliver
definitely,
care, who feel this. I think what they're now figuring out is that Wall Street isn't on anyone's side but its own. And if
yeah,
they can squeeze a dollar out of a patient, great. If they can squeeze a dollar out of a provider, that's great too. And I think
right.
providers are now living with this. We're seeing this with private equity gobbling up, healthcare. And so I think that providers have kind of come around to experience a lot of the same pain and frustration that patients have been.
And one of the things I wanted to talk with you about is in particular is this consolidation that's happening across healthcare, because uh, the lack of competition is worrisome, and it's getting worse. I just read about United Healthcare, and the amount, or United Health Group, I should say, which is the overarching company that owns all these subsidiaries of United Healthcare. The amount of internal revenue from their own revenue sources is up like 25% over the last year. And so that just shows you just how much consolidation, how much vertical integration there is. And I think it's making so many things worse. And so, what for people, a lot of my listeners are starting to feel, especially people in healthcare, are starting to feel kind of hopeless about this, because you have this behemoth, Optum, United Healthcare, and other ones, Cigna. They're all doing this. What what are we doing, or what can we do to fight against this? And what's happening in government? Are people looking at this? I mean, I know you are, but do you have others that are focused on this issue?
Yeah, I mean, I would say that generally, President Biden's administration, one of the really terrific things that I don't feel like it's talked about really ever, much less enough, is one of the things President Biden's administration has really done is focus on competition policy. In other words, cracking down on monopolies, challenging that the idea that every merger is somehow for the good or for the better. And so it's really hard to think of an industry today that doesn't have a monopoly problem, right? We have monopoly problems with publishing. We have monopoly problems with travel. We have a bread
Hmm.
monopoly in this country, for crying out loud. And so something like 40% of all bread that we eat is all manufactured by one company. And so
Really? I had no idea.
Yeah.
in
You got a
some
bread
ways,
monopoly in the U.S.?
yeah. And so, in some ways, I think it would be surprising if we didn't have monopoly
Yeah.
power and a lack of competition in healthcare. To date, I haven't seen the Biden administration kind of turn its competition policy focus to healthcare particularly, but they are kind of cracking down on a lot of these industries and trying to think about what to do. But I think one of the things, I'm old enough, I'm 50, I just turned 50, and I can remember as a kid, boy, if you could get like back in the day, Blue Cross, then you just knew everything would be okay. And
Hmm.
today, the truth is, there's only three or four health insurance companies, and they all suck. And
Yeah. Yeah.
There's probably an equivalent. It's kind of like airlines. There's only 3 or 4 of them, and mostly your experience getting to and from sucks. And of course, there's like a bottom dweller, like a Spirit. There are a couple of those kinds of healthcare insurance companies, but in general, I would say the problem is systematic. So I do think
Yeah.
competition would help. But the other problem in healthcare is people don't get to make choices. We don't have a market for healthcare. So you asked me, are we ever going to fix this? I think one of the things we have to recognize is we can't keep relying on market forces like consumer choice, like patient choice, to fix something when in fact patients don't have
We have
choices.
no choice. Yeah.
Right.
We don't know how
And
much things cost. We
You get,
don't know what our alternative options are.
and you get a job, and you basically have to go with whatever your job offers, right?
Yeah.
So
yep,
yeah, you're absolutely right.
One of the things that does make me feel a little bit hopeful, at least, and I hope you're not about to burst my bubble, but it's okay if you do. But is that you have, taken this historically very Republican county, and you've been, elected with Medicare for all as a major part of your platform. And those two things, are kind of, historically speaking anyway, at odds with each other. So can you talk a little bit about how you've done that, and is there anything that kind of the general public or healthcare workers can take from your approach there to try to make these changes in healthcare?
absolutely. I mean, look, Medicare for all is would deliver the best quality care at the lowest price point with the most patient choice. Wow,
Mm.
it's a winner all the way around. And we see this. I mean, we know that when people get Medicare, that cancer diagnoses jump. It's not because all of a sudden people are getting cancer. They're actually getting screening that is detecting that cancer. There is no insurance company in the United States that provides the depth of network choice that Medicare provides. That's a battle we have to keep fighting to make sure providers continue to take Medicare. But the reality is, we should all want a healthcare system that gives us the most choices and the best quality care at the least cost. And so I think that's why Medicare for all makes sense. It's not a lefty McLefty kind of argument. It's actually just common sense. It's actually the fiscally responsible thing to do. And so I think that is an important thing to start with and to explain to people right up front. Private, for every $100 we spend with a private health insurance company, $17 go to administrative costs. With Medicare, that's about two to $3. That's a lot of money multiplied. Take that $100 that I used as the example and multiply it times all of the money we're spending. So in one hearing, I actually had 17 ones and kind of counted them
Hmm.
out so that people could see, and then held up those bills versus the $3 we spend administratively on Medicare. And it's everything from not advertising and sponsoring stadiums to not having all the complexities of billing and denying care and the things that we go through with private insurance.
I like the idea of Medicare for all, because you look at all the richest countries in the world, and we're the only ones that really leave people behind like this, that don't have a public option for everyone. The But this doesn't happen in a vacuum, right? And one of my concerns about something like Medicare for all, and like making a switch like that, just like that, is the healthcare worker shortage that we have. And we're talking about all of a sudden doing a great thing, which is making sure everybody, like, we lift the floor, right? Everybody has access to affordable healthcare. How are we going to take care of all these people like that? That's one thing that I think about. And because we're struggling with that. People are leaving healthcare. Doctors, nurses are leaving healthcare. And so we have to figure that piece out as well. Like, okay, what are we
I
going to
mean,
do?
aren't you going to be taking care of them on one end or the other? You take care of them on the front end, or you take care of them on the back end, but you're going to be taking care of them. And it's going to be worse if you wait till the back end.
That's why you married up well, because that's exactly what I was going to say. So, look, at some point, people get care. It's just where. Do they
Mm-hmm.
come in with untreated diabetes to an ER and we're having to amputate and then try to provide disability services? Or are they getting care on the front end
Mm-hmm.
that is helping them prevent or treat or manage that? So, I think the other thing is who's really getting squeezed is we have a lot of people who are on Medicaid already as well as Medicare. And so when you add up the low income Medicaid people and the
Right.
Medicare, the seniors, and then you add on the veterans and you add on the who are in the VA system and you add on the TRICARE for the active duty service members, we already have a lot, more than half, I believe, of our population in some form of government healthcare. But even that duplicity of having those four systems is a lot. I would say,
Yeah.
with regard to healthcare workers, look, they are in crisis. My sister and brother-in-law are both physicians. I hear about this from them. I hear about it from doctors when I go in because I can't just go, get screened. I also have to hear about their healthcare frustration policies.
Right.
So it's really an incentive for me to go get healthcare. But one of the things they're frustrated about is insurance companies. Is the amount of
Yeah.
time that they
Mhm.
spend fighting. They ask people to make follow-up appointments, and the people don't show up. And when asked why, it's like, well, I was on hold for 45 minutes trying to schedule that, and then I just hung up. Right. And
Mm-hmm.
so I do think that, we have to rethink how we fund medical education, whether having the kinds of debt that we've been putting on healthcare providers really serves us well. I think it does not.
Yeah.
Um, but, I would say that I think if we move to a Medicare for all system, we would face, I think, some shortages in primary care and in some of the areas where we need to be treating people earlier. And I think, but we would see some of these kind of specialties that kind of feed on unhealthy people,
Yeah.
hopefully over time decline. So,
Yeah, we definitely need to. I'm so glad you mentioned kind of reform of the medical education system, because it does need to be a sea change in how that's funded and the cost of medical education in particular. But yeah, like we need to uh, just primary care is in such a crisis already, and I don't know what it's going to take to change that. It's going to be I find it, maybe I'm just skeptical, or maybe I'm just too pessimistic, but the idea of having like a sudden change, like how do we get to this point? How do we get there? Is it going to be incremental change, or how do we go about this?
so look, the biggest barrier to addressing the profit based healthcare system and how it kind of malforms our healthcare system is big money in politics. So the answer that
I'm
Kristen
glad you
gave
said that. I was going
earlier
to ask about that.
about Citizens United, I mean, look,
Yeah.
Washington runs on lobbyist dollars. I don't take lobbyist money. So I meet with lobbyists when they have information to give me, but I'm not for sale. It runs on corporate donations. I don't take corporate PAC money, and I never have. So I think that, what we are seeing is time and time again, Washington making policy decisions based on who's buying and paying for them, not on what's sound policy. So I think, we just saw for this first time with this bill allowing Medicare, for instance, to negotiate drug prices. My bill was signed in law that would recoup, kind of get back taxpayer dollars when big pharma raises the price of medicine faster than inflation. These are already developed medications.
Right.
And so this is one of the first time that we've seen Washington stand up to big pharma, like in my entire lifetime. And so
Yeah.
I do think that those of us who don't take corporate PAC money and are asking hard questions that often haven't been asked are starting to shake things up. So I'll just give you one example that for me was a really sort of important moment for kind of inspiring me to stay in this fight, even though it's hard, is I had the director of the Center for Medicaid and Medicare Services, CMS. I mean, these people have great names, CMS. And I asked her, what evidence is there that Medicare Advantage, which kind of takes Medicare and layers private insurance into the stew, rather than traditional Medicare, which is just you go to the doctor, the government reimburses you, right? So no private health insurance. Medicare Advantage, this private health insurance layer. I said, what evidence is there that this makes seniors either healthier or cost less? It doesn't even have to do both. It's just doesn't do either of these things.
Right.
And you know what she said? There is no evidence. And I
Yeah.
said, well, why are we expanding a program that doesn't make people healthier, give better outcomes to seniors, and doesn't cost taxpayers less? And the answer is, of course, that big health insurance companies make a fortune off taxpayers. United Healthcare, you mentioned them earlier, $3 in $4 they make are taxpayer dollars. So one of the things I would love is
That's
to have
depressing.
taxpayers forget advocating as patients, which is really
Yeah.
important, but it's hard to advocate as a patient because you know why? You're sick, definitionally, or you're
Right.
scared, or you're in crisis, you're fighting for your
And your
life,
stakes are enormous. Yeah.
right? And so we need to all, as taxpayers, really be saying, are we really getting what we're paying for here? And so I call it, instead of calling it Medicare Advantage, I call it Medicare Disadvantage, because the truth is it doesn't provide better outcomes, and it costs more. And so we should just stop doing it. And why we're not stopping doing it has everything to do with how most of my colleagues have funded their political career. And it's a big difference between me and them. And I think I do ask questions differently and I do push on things differently because of that.
I'm so glad you do too, because like the cynic in me feels like, well, everybody's just bought and paid for these days. So I don't know. What can we even
This is
do?
proof that there's some people that are not bought and paid
Yeah,
for.
exactly. I need that every once in a while to, keep some modicum of faith in the system anyway.
Yeah, no, I mean, look, like my class, I was elected in 2018, sort of in the wake of Trump's election in 2016. And a lot of the members of my class didn't take corporate money. We didn't run our campaigns on it. And we haven't gone back. That said, there's an entire industry of kind of K Street lobbyists whose full-time job it is to convince you that if you do not take their corporate dollars and you do not do what, sort of Wall Street wants, you will not get reelected. And that's a bunch of nonsense. And I think I've had really tough campaigns in Orange County, and I've shown that actually what Americans want is people who fight for what's right, who fight for them, and that they will respond. They will make grassroots donations, and you're able to fund your campaign and to win tough races.
Yeah.
We
It all
talked,
sounds like the mafia. Sounds like the mafia is running this country.
yeah, like I imagine like briefcases full of cash just coming into Congress people's offices and
It's so much more subtle than that.
yeah,
And I think that's one of the hard things is I talk a lot about corruption. And I think people have this, we do have that too, right? Like we had Senator Menendez with these gold bars sewn in his suit, which is like kind of the mafia corruption vibe. But
Right.
it's a little on the nose.
Yeah.
it's a lot more subtle than that. I think it is. One of the things is, who are you listening to? So organize, insurance companies have lobbyists. They come, they meet with your staff, they knock on your door. And I think you really have to work actively to counter that. So where are you getting your information about what the healthcare system needs? Who are you listening to? And so I really try as much as I can within the boundaries of my job to look at some of the good health policy research that's coming out. So I don't know if you have covered this in your show yet, but the study that came out right around Christmas, which is really when to get everyone's attention when you have a big, showed that if you go to a hospital owned by private equity, you have double the rate of coming out with an infection. Like
I've talked about that study. That was unbelievable. Yeah. Yeah. I mean, it wasn't unbelievable. It's perfectly believable,
logical
but
based on how that model works.
But it's that I'm so glad that study came out. I have talked about that, and basically I forgot what the percentage was, but it was statistically significant that the number of adverse events that happen in the hospital was higher in these private equity owned.
Yeah, because they're just making all these cuts, and so a lot of checks that are normally there get
because what they want to focus on, what these private equity owned hospitals want to focus on is mortality. They want everybody focused on mortality because they can show that they have less mortality. Well, why do they have less mortality? Because they don't admit sick patients.
Right.
Yeah.
They skew younger. They want people that are not going to die in their hospital so they can say, look, we are safe. So that's why I'm so glad that study came out, the people that did that, to look at what's happening in the hospital, because
Yep.
that's really an indicative of the quality of care that you're getting.
Well, and as
And
you know, I mean, if you get a hospital-acquired infection, or say, I think they found that you had a 30% or 31% higher likelihood of getting an infection in your central line if you
yep,
needed one,
Mm.
then what happens to you? Broad spectrum antibiotics to the tunes of thousands of dollars, longer hospital stays. All of that is expensive. And ultimately, what I really want to emphasize to people is who pays?
yeah,
We all pay. We
Yeah.
all pay.
three out
And
of $4,
so
right?
three
Three
out
out
of
of
four
$4.
dollars, right? So because of, those people going into those hospitals have Medicaid, they have Medicare, so we all pay. And so I think, and by the way, that doesn't exactly cause people to have a positive association with going to get care, when what they do while they're there is get sick. Now, infections can happen, but it's very, very
Mm.
clear that this is driven by staffing decisions. And I think about how it would feel to be, a nurse, to be a doctor, and to think to yourself, my gosh, everyone here is getting so sick, right? The rate of
Mhm.
infection is so high. And so now the question is, having that study, what's Congress going to do about it? And the
Yeah,
answer should clearly be cracking down on the role of private equity in healthcare, because they may not be killing us, to your
right.
point about mortality, but they are making us sicker, even as we go ostensibly to get healthcare.
Absolutely. And they're making healthcare workers more miserable. Like morale
Yeah,
is in the tank.
they're contributing to the shortage because nobody
And
wants to work that way.
it's so interesting from a physician, from a healthcare worker standpoint, because you know trying to get most of the physicians out there to like take a stand against private equity, it's been a little bit harder than you'd think, right? Because going back to physicians being part of setting up health insurance companies and basically forming the healthcare system we have way back in the day. I feel kind of a similar thing with private equity, because you do have a lot of physicians that are reaping enormous benefits from selling their practices to private equity. And so it's this kind of towing this line of, okay, well, do I how much does it take for me to look the other way and realize now that, okay, this is making healthcare worse, while also benefiting financially from it.
Well,
And so
I think one of the challenges is I do hear from a lot of physicians that who have had smaller practices or practice groups, maybe three or four doctors. Like when I grew up, my pediatrician had one doctor. It was him, Dr. Alberts. That was He's a
right,
very famous pediatrician in Iowa, and it was just him. Those are disappearing, but part of the reason they're disappearing is health insurance companies, because all of the billing and the complexities and having to figure out which plans you take and don't take. So, look, private insurers spend about $200 billion a year more on administrative costs than traditional Medicare. And so when we think about Medicare for all, you're thinking about saving all of that money in the switch. And so I think I would like to have more patient choice. I would like to have more doctors that I could go and see. And I think we're not going to get there if we don't make it administratively possible for physicians to have practices on their own in small groups. The
yeah.
economy of scale in medicine, the bigger and bigger and bigger, and the chains, all of that really serves to strengthen the hand of a handful of big corporations at the expense of giving both providers and patients choices.
So now I know that there's Congress is starting to look a little bit more closely. We've already touched on that, on like big pharma and insurance companies. I haven't heard much about private equity though.
Um,
Is that a focus?
yeah, I would say there's a group of us who can, surprise, surprise, don't take corporate PAC money, within the
Imagine that.
it's some of the same folks, by the way, who are focused on Medicare Advantage and what's wrong with it, why it's not actually an advantage.
Okay.
It's some overlap there. So I do think I can concretely show you that the number and sort of who's leading on these issues. There are people who do take corporate money who are good on these issues, but the kind of energy around it is coming from people who don't take money. I would say, actually, I do think that Congress is very focused on pharma and big pharma. And we have this
Yeah.
thing now, like it's like big oil and big pharma. I've been talking a lot about big insurance, and I think that needs to become much more of a thing. I think insurance companies sold themselves in the 90s and early 2000s in the run up to the Affordable Care Act as kind of the good guys. That all we needed was insurance, and then everything would be okay. And the truth is, insurance doesn't work if the out of pocket maximum is completely ridiculous. It doesn't work. If you don't have the savings to be able to go and meet your deductible, then that deductible might as well be $10 million instead of 5,000. And so I do think that there needs to be more of a critique of big insurance companies and whether Congress is focusing too much on trying to give everyone insurance without being willing to really look underneath that and say, well, we really have to be delivering is healthy workers, a healthy workforce, healthy families, healthy kids, dignity in aging. Like, that's the policy goal. Insurance is one, having more insured people is one tool to get people there, but it's not the goal in and of itself. And I think that insurance has kind of sold too many people in Congress. Too many career politicians who've been there 20, 30 years are on the, well, like, if you have insurance, it's okay. Whereas what I have seen in my lifetime is I can have insurance. It doesn't mean I'm going to be able to get care.
Yeah.
It doesn't mean I'm going to be able to find a provider. My sister had melanoma, and so I'm supposed to get my skin checked like every 6 months or every year. It's like once every 5 years. And the reason is not that I mind having someone just look at my skin. It's because it's so annoying. The wait,
Yeah,
six. So I said to my dermatologist the other day, well, like, she said, we have no appointments for 6 months. I said, okay, can we look past 6 months? And she said, no, the system only lets us look 6 months out.
Oh my
So then
goodness.
what am I supposed to do? Like, get a flashlight and just be like, what looks cancerous to me?
That's right.
So I think all of those things are, they're really discouraging to providers who then have someone come in and they have to deliver bad news. And so I really do think we have to ask our elected officials, and I would encourage people who listen to this to talk with their elected officials. Not what are you doing about costs? What are you doing about insurance? What are you doing in Congress to make us healthy, to keep us healthy? And so I'm really taken with, and this is a suggestion of a future guest for you if you're interested, is I'm a big fan of Senator Cory Booker's work on the Farm Bill and looking at how Congress affects people's nutrition through what we subsidize, what kind of food we subsidize. So he has this whole really wonderful kind of vision of, if you want to have healthy people, you need to make healthy food affordable. And so, like, stop subsidizing sugar, right? Start thinking about, are you giving people enough food assistance that they can use on fruits and vegetables? And so I've actually done some things where I've gone into the grocery store and shown, like, what you can get for fruits and vegetables. And so, like, I don't need, people who are struggling and don't have enough money, like, you can tell them over and over again how great the antioxidants are in pomegranate juice or blueberries or the omega in salmon. They can't afford healthy food. And so then we turn around and we have to have the conversations with them about obesity and type 2 diabetes and other things. And so he's got a really good vision of kind of food policy as health policy that I think goes back to this sort of rewriting the Washington narrative. It's not about how many dollars can we funnel to insurance companies and Wall Street healthcare. It's about, can we make people healthier?
Oh, it's a big job.
It sounds. Can you explain all of this on a whiteboard to me, please?
I was going to say, it doesn't surprise me that you said that you had a teaching background, because that was the first thing, and I saw your visual aids, when you first started using them. I was like, that lady's been a teacher. I bet you anything.
Oh,
Yeah.
and I tell you, it spoke also to the medical crowd too, because we get a lot
They
of
love a
whiteboard
whiteboard.
presentation. We love a good whiteboard presentation. Oh man, I'm sure you've heard that feedback as well. My one question I have for you is: are the whiteboards getting bigger? Because I swear,
Oh.
I just recently saw a screenshot of you. It's like I don't know. It's like 4 feet by 5 feet.
Yeah.
It's like enormous.
From whiteboard earrings
Oh
that
my
are
goodness.
they're really great.
You're leaning
I have
into it. I love
little
it.
whiteboard earrings, and I have everything in my district office. My staff got so frustrated with me being like, "This whiteboard's too big. This whiteboard's too small." They would try to they'd buy one and then they'd be like, "Oh no, we just painted the wall." My district director just went to Lowe's and got the whiteboard paint, and we just
Yeah.
painted the entire wall whiteboard. So now it
Perfect.
really, because
Perfect.
sometimes when I'm explaining a really, really big bill, it takes a lot of whiteboard real estate
Right.
to get that done. But I think in Congress, one of the things that, I often think about is I think there's an effort to sometimes obfuscate these issues because
Yeah.
people don't want Americans to ask the questions. So they say, well, it's really complicated. Most of this is not that complicated. Like if you
Mhm.
have a health industry that profits from sickness rather than wellness, you will end up with this kind of system.
Right.
There it is.
Well, and I have one question I want to ask before we have to wrap, but that's just you hear all the time, and we've even asked it to you today of, what basically what the question is, well, what can you do? What can you and your colleagues do about all of this? But what can we as citizens do? We've asked that too, but what can we as whatever we are, right?
You and
This
me.
category of people. Well, I guess maybe, sure, you and me, but also kind of healthcare influencers, or I don't like that term, but, you know,
People with a
people
platform.
with a platform. Yeah. What
Mhm.
can we do to help, you know, solve this problem as well?
Yeah, I mean, I think it's really important that we're empowering everyday people to ask questions, not just about their own health, like, does this medicine have any side effects? These are important questions, but also to ask questions about healthcare policy. So one of the suggestions I had was ask your elected officials, what are you doing to make people healthy? What is the policy that you're focusing on to make people healthy? I think that people should ask their elected officials if they take money from corporate PACs, if they take money from pharmaceuticals. I think they should ask whether they're meeting with just insurance companies, just hospital chains. Are you meeting with any solo practitioner physicians? Are you meeting with nurses unions? Are you you need to, or patient advocacy groups? I think elected officials need to be hearing from all of those people. And so I would really encourage people to engage their elected officials even more on healthcare. And I
I love
think
that.
the kind of don't destroy the Affordable Care Act, that was an important moment. But in the wake
Mhm.
of that, we really need to be looking at what still needs to be done. And the answer is a lot.
What are you doing to
Yeah.
improve health? That's
Right. To make us
yeah, to
healthier.
make us healthier.
And
Absolutely.
and can that make a difference up against all this lobby money?
Oh, absolutely, it can. Because a lot of what Washington suffers from, I mean, yes, there's this sort of bought and paid for phenomenon that we've talked about, but it's also a lack sometimes of ideas and imagination. So I sometimes say, only half joking, that Congress's motto is something like solving yesterday's problems tomorrow, maybe. And so it's, really looking forward. So, like, one of the things I'm focused on is we have a huge group of people who are going to be aging into Medicare who have had access to mental health care in a way that maybe a generation or two before didn't. Medicare does not have nearly enough psychiatrists and therapists, and we're not set up for that. So let's get ahead of it, right? Let's think about it. And so I think kind of challenging the status quo is one of the most important things that people can do. Is, everybody should ask their elected official, if Medicare spends so much less than insurance on administrative costs, why aren't we in favor of that?
Yeah.
And
Yeah.
the people will have answers, but it's an okay to question. It's a question we all should be asking. How do we reduce administrative costs and increase care outcomes?
Absolutely. It's going to result in important discussions
And it just seems like it just
between
makes
people.
sense to everybody, no
Yeah.
matter what side of the aisle you're on. That's just good common sense.
No, it should be.
You should be, but I will tell you,
It's not that easy. Yeah. Yeah,
that's not
Yeah.
exactly.
how it feels a lot of the time. A
Right.
lot of the time there. So, but I think one of the things you guys do is really get facts out. So, the discussion we just had about infection rates in hospitals, that study,
Yep.
the story I told about how Medicare Advantage doesn't make us healthier. then why
Right.
are we doing it? So if private equity hospitals don't deliver as good of outcomes, stop
Let's have less of those.
let's have less of those, right? So I
Exactly.
think that data part of it is really important
Yeah.
to then driving the policy discussion. And I think you guys are in a perfect position to help elevate some of those studies and some of that research, and to help people figure out how does it translate into policy.
Well, we will try to do our part, but
Right.
but thank you so much for being such an advocate for just everybody getting healthcare, getting affordable healthcare. We need more people like you. So thank you for that. And before we go, you're running for Senate.
Yes, in California, um, California has been a state that has driven a lot of healthcare innovation, and also has some of the biggest healthcare inequities and challenges. And so it's an exciting race to be able to talk about what to do about healthcare, and to kind of I'm the only candidate elected official in my race who doesn't take corporate money, who doesn't take lobbyist money. And so I think to the extent people say, she's a little different, she sounds different, she focuses on different things, there's an explanation for that. And so
There you go.
it's an
Yeah.
exciting race. And the primary is coming up very quickly. I think we have 50 days to go. And so March 5th, Californians need to vote.
March 5th, get out and vote. Well,
Yes, definitely. Because we need people like you in Congress. We need people
yes,
pointing these things out and calling it like it is.
absolutely. Well, Congresswoman Katie Porter, thank you so much for joining us. It really was an honor to have you talk with us today.
Awesome. Thank you so much.
Kristen, are you familiar with AI?
Yes, I have not been living under a rock.
There are AI tools for everything now.
That's right.
Well, guess what? We have Precision. This is the first ever EHR integrated infectious disease AI platform. This is super cool. For any specific patient, it automatically highlights better antibiotic regimens. It empowers clinicians to save more lives while reducing burnout. Just makes their life easier.
That's pretty cool.
Yeah, and also antibiotic stewardship,
Yeah.
really cool things. To see a demo of this, go to precision.com/KKH. That's precision spelled with an X instead of an E. So prxision.com/KKH. Wow, what a force she
Yes,
is.
definitely.
I
I
was,
love it.
I love it's such a fresh perspective from someone who doesn't take the money from
Yeah.
lobbyists.
Right. Just the fact that there are still people
Like,
that
why
don't do
can't
that, that's
everybody,
so hopeful
why
to
can't
me,
it be
but
like
it
that
shouldn't
for
be that
everyone?
surprising. I know, exactly.
Right?
Well, I
Can,
told you
can,
why.
can that just be a rule? Like you go to Congress, you're not allowed to take, no one's allowed to lobby ever.
I would
How
love
about that?
that.
No,
Oh, yeah.
zero lobbyists. How about that?
Well, it would still happen. It would just be under the table.
Easy for
But
me to say
yeah.
as an internet comedian, ophthalmologist, podcaster. But, I can have all the wishes I want, but, it's
Yeah,
not
what is
reality.
that? If wishes were,
I don't know what the thing is.
I don't
I know what you're
either.
saying. But it was as super cool to just hear her perspective.
Yeah.
And we agree on a lot of things. Yeah.
Yeah, we do personally with her, but also I love that there are, I mean, I can think of a few other examples too, but there are these particularly women in Congress who are just these straight shooters and are willing to say it like it is. And that is refreshing to me, because everything is always so, like she said, it's always so obfuscated. So
Right.
people that can just spell it out so clearly, I think is desperately needed. And that's kind of what you do in your comedy too.
Yeah. If there's one place that we need clarity, it's with healthcare issues.
Yeah, it's
Right.
so
It's enough.
confusing and
It's confusing
purposely so.
enough. And so, yeah, break out those dry erase boards and
That's right.
get to work. All right. Well, let's take a look at a medical story, should we?
All right.
All right, here we go. So we have a fan story from Sandy. Sandy says, I am a nurse and specialize in maternal child health. During clinicals, when I was in nursing school, I was assigned to the PACU at a military hospital for one shift.
What's PACU again?
The
Remind me.
PACU is post anesthesia care unit. Yep. So right after you got done with the surgery, they
Yeah.
put you in the PACU.
You go wake up
You go wake up there and you thrash about. I was
about bread.
I think I thrashed about. I was settling post-op patients and monitoring vitals nearby when a young officer called me over to his bedside. In recovery for an appendectomy and still groggy from anesthesia, he motioned to me towards his crotch under the sheets and mumbled, "Something feels warm down there." I gently moved the sheets
Not
aside
what you
and
wanna
realized
hear.
he was hemorrhaging from his
That is
urethra.
not where I thought that was gonna go.
Oof. I alerted his nurse, as well as the attending, who both came to assess the situation. It was decided that controlling the bleeding was the biggest concern and that the student nurse should be tasked with applying pressure to the bleeding phallus.
Poor students. They always get the worst jobs.
They determined that his urethra was lacerated during removal of the catheter.
Oh my gosh.
And the urologist was called down to emergently place a catheter as a tamponade. In the meantime, I was left making small talk while firmly grasping a stranger's penis in my hand.
Well, if I had a nickel.
The situations you find yourself in medicine.
Oh my goodness.
But I love every time we get a story like that. And we haven't really had a story like that, but
occasionally you get some
embarrassing situation story. I'm always impressed by just how professional everyone is.
It's
right?
true. I mean, what are you gonna do?
What are you gonna do? You gotta keep it professional. And then maybe down the road, you can have a laugh about it. But right in the moment, you just got to get the job done.
That catheter part, though, oh my goodness.
Do you have any medical stories about holding penises? You can send us those or any other story you might have.
You need to be careful what you ask for. We're going to get all sorts of strange. Oh, boy. Sorry, Shanti.
Knock hi at human-content.com. Hey, Kristen.
What's up?
Name something that's like crusty and flaky.
A delicious croissant.
I appreciate your optimism.
Yeah.
Yeah. You know what I was thinking?
What?
Demodex blepharitis.
That is not as delicious.
Do you know what these little guys are?
What?
These are Demodex mites.
Yeah, that's not
They're cute,
fun.
though, aren't they?
Those ones
They're
are cute.
If you have red, itchy, irritated eyelids, you might be surprised to find out that it's a disease called Demodex blepharitis caused by these little guys, Demodex mites.
Do you ever see those in your clinic?
Yeah, occasionally. It's not uncommon.
Are they that cute when you see them under the microscope?
Not quite. All right, but you
That's
can
too
make
bad.
an appointment with your eye doctor and get an eyelid exam where they can help you know for sure if what you're suffering from is Demodex blepharitis. To find out more, go to eyelidcheck.com. Again, that's EYELID check.com to get more information about Demodex blepharitis and these little guys, Demodex mites. All right, let us know what you thought of the episode today, of the story, or what Congresswoman Katie Porter had to say. We'd love to hear your thoughts about healthcare. Let's hear it. We're open to all your ideas. And also let us know if you have any guests we should invite on.
Yeah, it's a big, complex topic.
Looking for suggestions. Lots of ways to hit us up. Again, you can email us, knockknockhigh at human-content.com. We also have social media network. We have social media networks. We have lots of networks.
We don't have a social media network, to be clear.
Should.
The Glaucomfleckens
network. I don't know how to make that happen. We'll get our producers on it. You can hang out with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the great listeners leaving feedback and awesome reviews. We love that. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like today at Laura Garber 9544 on YouTube says, one of your best yet. I learned so much. That was in regard to the palliative care episode.
Oh, probably with Dr. Jared Rubenstein.
Yeah, that was a fascinating episode.
I have heard a lot of that kind of feedback to that
people
episode.
Really liked hearing about that.
Which I like because I think there is a lot to learn about palliative care and it can be useful to lots of people. So let's keep learning.
Absolutely. Full episodes of this podcast are up on my YouTube channel. Those are video episodes. You can see our faces when we're talking if you want.
If you want.
At D Glaucomflecken. We also have a Patreon. Lots of cool perks, bonus episodes, or react to medical shows and movies. You can hang out with us, the other members of the Knock Knock High community. We're active in it.
We just got to watch a couple shows the other day. That was super
fun.
We
watched
posting those soon.
A little clip from The Office and reacted to that.
Such a good show.
It's great. Early ad-free episode access with the Patreon, interactive Q&A live stream events, and much more. Maybe we'll have an election in our Patreon group.
Well, you are always saying how it's a little town in there, so we do need some elected officials, I suppose.
Maybe you and I can go head-to-head as CEO of Patreon
That's not going to
Town.
be any kind of race.
Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out to Michelle C. Thanks, Michelle. Thanks for joining us. Shout out to all the Jonathans, as always. We have Patrick, Lucia C., Sharon S., Omar, Edward K., Stephen G., Jonathan F., Marion W., Mr. Granddaddy, Caitlin C., Brianna L., Leah D., K. L., Rachel L., Keith G., JJ H., Derek N., Mary H., Susanna F., Mohammed K., Aviga, Parker, Ryan, Medical Meg, Bubbly Salt, and Pink Macho. Patreon Roulette. Random shout out to someone on the emergency medicine tier. We have Ian P. Ian P., thank you for being a patron.
Ian?
And thank you all for listening. We are your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest, U.S. Senate candidate and Congresswoman Katie Porter. Our executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Our editor and engineer is Jason Portiz. Our music is by Omer Ben Zvi. I think this is the best outro I've ever done.
Well, I'm glad you think so.
To learn about our Knock Knock Highs program disclaimer, ethics policies, mission verification, licensing terms, and HIPAA release terms, go to glaucomflecken.com or reach out to us, knockknockhigh@human-content.com with any questions, concerns, or fun medical puns. I'm trying to really get people going here in the outro. It's ready to.
Through to the end.
You've heard the episode. You're ready to just take the day by the what.
If anyone's listening on 2 times, how you can speed it up, then you probably are like an auctioneer or something.
Oh yeah. Knock Knock High is a human content production.
Goodbye.
Hey, Kristen.
What?
You know what people ask me about?
How tall you are.
No, sometimes. But no, they ask me about Jonathan.
Yes, I have heard people ask you about that.
Everybody wants a Jonathan.
They
Is
do.
Jonathan real? Can I have your Jonathan? I'm like, no, you can't have my Jonathan. But you know what they can have?
What's that?
Dax Copilot.
Ah, yes, and that
Yes.
is basically a Jonathan.
It is like having a little Jonathan there. It's an AI-powered ambient technology. It sits there in the room with you, and it helps create that clinical documentation,
Right.
while also allowing you to create a patient-physician relationship that we all got into medicine to have. We all want that.
That's right. Nobody got in to start writing notes.
That's right. And it is right now, everyone feels overwhelmed and burdened by all this clinical documentation to where work-life balance, it just seems unattainable.
Right.
So to learn more about the Nuance Dragon Ambient Experience or DAX Copilot, visit nuance.com/discover DAX. That's nuance.com/discover DAX. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.